So just a general update on the coronavirus situation. Current numbers, there are 17,386 reported cases, 362 deaths, all but one of which is in China. 181 cases outside of China, including the now 12 confirmed cases in Australia. There's no further confirmed cases in Australia, and as you've heard, 3 of the cases in New South Wales have been discharged and are free of virus. The death rate is still around 2%, the severity rate is still around 18%, and most of the growth is in the Hubei province of China. I would just like to provide some clarity around the requirements for isolation for people coming out of other parts of China than Hubei province. As you know, we've had for some time a requirement that people who've come from Hubei province all should self-isolate for 14 days. The requirements for isolation for people from other provinces of China apply only to people who have left or transited through China from the 1st of February, so on or after the 1st of February. So if somebody has come from China on the 28th of January, spent 4 or 5 days in another country and come to Australia, they will not be denied entry and they will not be required to self-isolate. The reason for that is that it was only on the 1st of February that our epidemiological data was such that the growth in numbers outside of Hubei province was such that we now believe that human-to-human transmission is occurring in those other provinces. But the numbers are still relatively low, and the risk for people coming from those provinces is still very, very low, but we are being absolutely cautious and extending our case definition to all of China and extending those quarantine arrangements. So it's only for people who left China on or after the 1st of February. Thank you, Minister.
Thank you very much, Brendan. Ladies and gentlemen, any questions?
Minister, there was a 6-hour delay or so of the flight getting out of Wuhan. What was the reason for that?
I understand it is a very intensive process to manage the immigration and boarding arrangements. Obviously, there were also requirements for Chinese medical examinations in terms of temperature and so on, which is very much part now, unfortunately, of everyday life in Wuhan. So that process takes some time. Also, checking, of course, boarding arrangements and the immigration details of over 200 people in what is a very sensitive process.
Minister and also Professor, could I ask what is the latest advice on how long the China travel ban might have to last? I think at the moment it's slated to go until March 31st, is that right? And could it go much longer? What is the advice on that?
The government's announcement was that we would put this in place for 2 weeks and that it would be reviewed, but I'll ask Brendan.
Correct. I think that's the government position, but clearly the Australian Health Protection Principal Committee meets every day and updates the advice to government, and government has said that and has adhered absolutely to the expert advice, but I can't believe that it would be reviewed before the 2-week period that's been announced by the Prime Minister.
Knowing what you know about the virus, do you think that this is the sort of thing that's going to be all over in 2 weeks, or are we looking at potentially much longer travel bans on visitors from China?
I think it's really hard to tell at the moment. It all depends on how well the Chinese government can control the outbreak, particularly in Hubei and particularly in the rest of China. The reality is, though, that the Chinese authorities have already started to reduce travel from China, and if the outbreak spreads further in other provinces, they're likely to restrict exit anyway. So the travel ban perhaps is less important when the Chinese are restricting exit anyway.
Just to be clear on the restrictions in terms of people returning from China, a lot of them might be international students, for example. If they were to travel now to a third country that would accept them, would that count as part of their 14-day period?
14 days since they left China. So if they went to another country for 14 days, they would be fine to come to Australia if they were well.
Is that something you might advise international students who are looking to get here as quickly as possible?
No, I think international students are obviously being advised by their universities. They're looking at all sorts of options such as online study in the short term. So I'm not providing specific advice to international students.
Minister, there's been commentary that around, I guess, sort of a racism element to the sort of things around, travel bans and treatment of sort of Chinese people with Chinese heritage in Australia and other countries and things like that. Suggestions that if something like this had happened like in a European country, we wouldn't be taking these sorts of steps on travel bans and stuff like that. Do you have a sort of a response to those sorts of issues being circulated?
Well, I would indicate, first of all, that every single step that the government has taken in recent weeks has been absolutely at the advice of the medical professionals and is founded only in the advice of medical professionals to deal with the spread of the novel coronavirus that we are now facing. Absolutely only founded in medical advice, and any suggestion otherwise I absolutely reject. I would also say to Australians, and in fact this would apply more broadly, that this is a very difficult time for many people. We know that there are families who are separated, there are families who are isolated, there are, as a previous questioner suggested, there are many international students who want to be part of continuing their education here in Australia. So whilst it is a difficult time, I think we would seek support and understanding from all Australians across communities to those that are having to deal with these challenges. We have taken the utmost precautions based on the health advice that Dr Murphy and his colleagues from the Australian Health Protection Principal Committee have provided to Commonwealth and to state and territory governments. We have ensured that Australians are as well protected as we possibly can. And so any extreme behaviour or negative behaviour such as that you have referred to is something which we would actively discourage. It's not necessary. We are working very hard to protect Australians, and in fact what we need at this point in time, as well as the best possible protections, is a little bit of understanding and a little bit of support for communities who are dealing with some significant challenges.
Can you talk us through what the process will be like when the people going to Christmas Island make it through to the 14 days? Will they have to book their own return flights to Australia, or will they get help with that? Will they have to pay for it themselves?
They'll be supported to return to the mainland and then to fly from there to their ports, their home ports.
Will that happen on individual cases, or will there be, say, a group of people that return in one flight to the other?
Well, not everybody lives in the same place, so obviously they'll be going to different locations, and that will be determined when we come to the end of the 14 days.
Is there on another topic? Earlier in January...
Can we just see if there's any more questions in relation to...
Have there been any more feedback from the Chinese government on the travel ban?
Feedback? Well, we're obviously speaking regularly to Chinese authorities, both in Beijing and here in Canberra. I think there is understanding that this is a significant international challenge and that Australia has taken steps very similar to many of our counterparts, Singapore, New Zealand, the United States and so on, and that our steps and our decision-making is absolutely predicated in the advice that we have received from senior health professionals who support government in these considerations. That includes the raising of our travel advice to level 4, do not travel at this point in time. We will be guided through this process in every step of the way by Dr Murphy and the Health Principal Protection team.
Minister, have you had any requests to use Australian facilities on Christmas Island to quarantine Pacific travellers to and from Pacific countries from China? I mean, is there any possibility that we could offer Christmas Island as a quarantine place for other nations?
We are having discussions with countries who have nationals who are stuck in who are in Wuhan and subject to travel restrictions. If they came to the Australian mainland, then or to Australia, as part of a removal, the expectation would be that they would quarantine also for 14 days, and the expectation would be that would occur at Christmas Island.
Is there plans for another flight there's several other flights, or what are you?
We will consider what might be necessary. We are very pleased that we have been able to uplift the 243 passengers on this flight and thank, as I said, all those involved in making that possible, including the authorities in China. But we'll consider what might be necessary, and I'll brief the Prime Minister.
There are some people making their way to Wuhan at the moment in expectation of a second flight. Are you saying that they might not have a second flight?
I'm saying that the government will consider what might be necessary.
Doctor, if someone gets diagnosed with the virus on Christmas Island, sort of thing, because of quarantine windows and things like that, does that mean the 14 days would start again for everyone else?
Yeah, that's a good question. So the plan is to cohort people in small family groups so that there won't be a full mingling, so that the whole group doesn't have to stay. If someone does get unwell, their family might have to start again for 14 days, but we wouldn't want to expose the whole group to get to that. So the team on Christmas Island, the advanced medical team from AUSMAT, are planning all of those eventualities to make it easier for people. Obviously you can't separate families, but we will try and keep people in as small possible groups as possible and avoid close contact with others, so that if anyone does get sick, we limit any necessary further quarantine.
So the 240 people, they're being kept separate now when they get to Christmas Island. They won't be able to sort of sit together in the rec room.
If they're contacting each other, they would need to wear protective things like a mask. So the risk, as we've said on many, many occasions, the risk for well people transmitting this virus we think is very low. The major risk is people who are unwell. So what the critical thing for the Christmas Island people is to avoid close contact with others, but if anyone becomes unwell, to immediately properly isolate them, and all the facilities are set up to do that.
This flight seemed to take longer to be organised for Australia than for some other countries, and I think even Turkey got its people or its arrangements in place before us. Was there any problems that arose because of the state of our bilateral relationship?
None whatsoever. In fact, our engagement with the Chinese authorities and the Chinese government has been cooperative and constructive. We have been making arrangements in terms of the period of time for which those Australians would be quarantined on Christmas Island. We needed to plan that very carefully to ensure we're keeping all Australians safe. I'm very pleased that we have been able to assist 243 Australians and in fact some very small children, as I said, and a large number of young people to return to Australia.
You gained some extra concessions in that residents were allowed to return. Talk us through that process. Is that, over and above what other countries have been able to achieve?
Well, we have been discussing with authorities in China, those who fitted into the category that Australia identified as being prepared and able to return. The Chinese authorities have been very helpful in that regard, so it is, I think, a total of 200 Australian citizens and 43 permanent residents.
Minister, earlier in January, Greg Hunt wrote to the Victorian government and revealed he's lobbied Michael Sukkar to include new questions in the census on gender and sexuality. Do you have a personal position on that, whether LGBTI Australians should be counted in the census?
I'm not familiar with the correspondence. I might talk to Minister Hunt and Minister Sukkar about that.
But the general issue about whether or not gender and sexuality should be included in the census?
That's not something that I've turned my mind to, and I might talk to Minister Hunt about that.
What about the Chief Medical Officer? Do you have a view about whether that would improve
I don't
health
think
outcomes?
that's something I should be commenting on at the moment, no.
Just quickly on the next steps from here, will they be taken from the RAAF base by military plane to Christmas Island,
Yes.
or will it be a Qantas flight?
Yes, military flights.
Sorry, Professor, just on the general threat posed by the coronavirus, 2% mortality rate, how does that compare to just the influenza that we get every year? And I mean, does this represent a more significant threat than influenza? Just wondering.
I'm being very careful to say that we really don't know at the moment. We're relying on information that's evolving rapidly. Certainly 2% mortality is much lower than SARS and MERS and the other coronaviruses, but they didn't seem to spread so quickly from human to human. The other thing we don't quite know is whether the mortality is largely in elderly people or people with other diseases. The Chinese have indicated that that's usually the case, and that's what we usually see in influenza seasonal influenza outbreaks. So it is the mortality and the severe illness rate could be similar to a fairly significant influenza outbreak, but we really have to be very careful about making clear statements about the severity of this condition until we get more and better data.
Thanks, everyone. Thank you.
Thank you.
Thanks, Brenton.